Hello, my name is Amir. So in this video, I'm going to be talking to you about care of patient with peripheral vascular disease. So first, we need to know what is the peripheral vascular disease. So peripheral vascular disease, or also known as PVD. So first, we need to know what is peripheral vascular disease. So sometimes known as PVD, it refers to a disease affecting our blood circulatory system in the peripheral parts of our body. So in this case, our hands or our feet. So one of the causes of PVD can be because of atherosclerosis, which is the buildup of plaque in our blood vessels. So an example is when the patient has atherosclerosis in their femoral arteries, which causes this peripheral vascular disease. So in patient with peripheral vascular disease, the decreased blood flow that's flowing towards the legs causes pain and cramping when the person walks. Now, these pain and crampings are called claudication, and it's because the muscles in our leg are not receiving the necessary oxygen to function properly. So, in some severe cases, when the muscles in the legs still do not receive the right amount of oxygen, they can die out and can cause the patient's leg to be amputated or needs to be amputated because of the dead muscles and dead tissue and muscles that have accumulated. So the first thing to know when taking care of a patient with peripheral vascular disease is to take note of which extremities it is affecting. So in this case here, we have the peripheral vascular disease affecting the patient's leg. So we have to uh, prioritize taking care of the patient's leg. So first thing we do is always protect the patient's leg from any sort of injury. A patient with an impaired circulation are at greater risk of ulceration, gangrene, or an amputation due to the pressure or an injury that is inflicted onto the leg or ankle of the patient. So we have to daily check on the patient's leg for any sort of irritation or injury the patient might have gotten. And we have to, if the patient is wearing socks or is walking around, make sure the patient's socks and shoes fit perfectly and it's not too tight or putting any pressure on the leg. So here, so hello sir, I'm just going to do a minor checkup. That be alright? You will. Okay, so I'm just going to open your leg cover. Okay, so is your socks okay, sir? Are they comfortable? Yeah. Okay, so can I open them and take it off for a moment? I'm just going to check to see if there are any sort of injury on top. Would that be alright, sir? Okay, thank you. So here I'm just taking off the socks of the patient to see to check if there are any sort of injuries the patient might have gotten. Okay. Okay. Another thing to note when caring for a patient with peripheral vascular disease is to make sure that the bed linen, in this case, the comfortability of the patient, is that the bed linen is not too tight or putting any sort of pressure on the patient's leg. And it is advisable to put a support beneath the patient's heels to keep it a bit elevated above the patient's bed. So hello sir, so I'm just going to ask if it's your bed linen or your bed cover is okay, it's not too tight, it's comfortable. It is okay. So now I'm just going to check. I'm going to put a support underneath your legs. Would that alright, sir? Okay. So here I'm using it's supposed to be a pillow, but I don't have a pillow small enough, so I'm just using a towel here. So excuse me, sir. Here, see, you put the legs above the pillow to support it and keep it elevated like this here. And so I'm just going to cover back, sir. And that is caring for a patient with peripheral vascular disease. Thank you for watching.